Did you know that men and women lose hair for completely different reasons? And making the wrong treatment choice could actually make your hair loss worse. Today you're going to discover the real science behind male and female hair loss, why it happens, why it looks so different from one person to the next, and what actually works based on real evidence, not internet myths. Stick around till the end, because the last section could save you months, maybe even years, of wasted time and money on the wrong solution. Hair loss is one of those things almost nobody talks about openly, but almost everyone worries about privately. If you've ever found more hair than usual on your pillow, in the shower drain, or in your hairbrush, you already know that panicky feeling. And here's the thing, hair loss in men and hair loss in women are often treated like the same problem, but biologically, they are not. The causes are different, the patterns are different, and in many cases, the treatments are different too. If you don't understand what's actually happening on your scalp, you could end up using a product that does nothing for your specific type of hair fall, or worse, one that isn't even meant for your body. So today, we're breaking it all down in plain, simple language. No confusing medical jargon, just the real science, explained the way it should have been explained to you the first time. Before we get into male pattern baldness and female pattern hair loss, we need to understand how hair actually grows, because everything else builds on this. Every single strand of hair on your head grows out of a tiny structure under your skin called a hair follicle. Think of the follicle as a tiny factory that produces one strand of hair, then takes a break, then produces another one. You have roughly 100,000 of these follicles on your scalp, and each one works on its own individual schedule. Hair growth happens in three main phases. The first is called anagen, and this is the active growth phase. Most of the hair on your head right now, somewhere around 85 to 90% of it, is in this anagen phase, and it can last anywhere from 2 to 7 years depending on genetics. The longer your anagen phase, the longer your hair can naturally grow. After anagen comes catagen, a short transitional phase that lasts only a couple of weeks, where the follicle basically shuts down production and shrinks. Then comes telogen, the resting phase, where the hair isn't growing anymore and eventually falls out to make room for a brand new strand to begin the cycle again. Here's the important part. Losing 50 to 100 hairs a day is completely normal. That's just old hairs finishing their telogen phase and falling out naturally. The real problem starts when this cycle gets disrupted, when follicles spend less time in the anagen growth phase and more time resting, or when follicles shrink over time and eventually stop producing hair altogether. That disruption is where male pattern baldness and female pattern hair loss both begin, but from very different directions. Let's start with hair loss in men, because this is the most common and most researched type of hair loss on the planet. The leading cause is something called male pattern baldness, and the medical term for it is androgenetic alopecia. This affects an enormous number of men, and according to the American Academy of Dermatology, by the age of 50, a large percentage of men will experience some degree of visible hair thinning or hair loss. The main driver behind male pattern baldness is a hormone called DHT, which stands for dihydrotestosterone. DHT is created when an enzyme in your body converts testosterone into this more potent form. Now, DHT itself isn't the villain here, your body needs it for certain functions, but in men who are genetically sensitive to it, DHT attaches to receptors in the scalp's hair follicles and gradually shrinks them. This shrinking process is called miniaturization. Over time, the follicle produces thinner, shorter, weaker strands, until eventually it stops producing visible hair altogether. And here's the key word, genetically sensitive. This is not about how much DHT you have floating around in your body. It's about how sensitive your specific hair follicles are to it. That's why hair loss can run strongly in families, and why some men start noticing it in their 20s while others keep a full head of hair well into their 60s. Male pattern baldness has a very recognizable pattern. It typically starts with a receding hairline, especially around the temples, forming what people often call an M shape. At the same time, or sometimes separately, thinning can begin at the crown, that spot at the very top back of the head. Left untreated, these two areas can eventually meet, leaving a horseshoe-shaped ring of hair around the sides and back. Age and family history are the two biggest risk factors here. If your father or grandfather experienced significant hair loss, your own odds go up considerably. Now let's talk about hair loss in women, because this is where things get more complex, and honestly, where a lot of women feel like they've been left out of the conversation entirely. Women absolutely experience pattern hair loss too. It's called female pattern hair loss, but it behaves very differently from what we just described in men. Instead of a receding hairline or a bald spot on the crown, female pattern hair loss usually shows up as diffuse thinning. That means the hair gets thinner all over the top of the scalp, especially along the part line, which often appears wider than it used to. Most women don't go bald the way men can. Instead, the overall volume and density of hair decreases gradually, and the part line becomes more and more visible over time. Hormones play a massive role here, but not in the exact same way as in men. Female pattern hair loss is linked to a mix of genetics and hormonal sensitivity, but women also deal with several other major hormonal shifts across their lives that can trigger hair thinning. Pregnancy is a big one. During pregnancy, elevated hormone levels actually keep more hair in the anagen growth phase than usual, which is why many women notice thicker, fuller hair while pregnant. But after childbirth, hormone levels drop suddenly, and a large number of those hairs shift into the resting phase all at once, leading to noticeable shedding a few months postpartum. This is usually temporary and the hair cycle typically rebalances within several months to a year. Menopause is another major hormonal turning point. As estrogen and progesterone levels decline, the relative effect of androgens like DHT can become more pronounced, which is part of why hair thinning becomes more common and more noticeable in women during and after menopause. Then there's PCOS, or polycystic ovary syndrome, a hormonal condition that can cause elevated androgen levels in some women, which in turn can contribute to hair thinning on the scalp, sometimes alongside other symptoms. Thyroid disorders are another important piece of this puzzle. Both an underactive thyroid and an overactive thyroid can disrupt the hair growth cycle significantly, because thyroid hormones directly influence how your follicles function. And finally, iron deficiency is an extremely common but often overlooked cause of hair thinning in women. Low iron levels can push more follicles into the resting telogen phase, leading to increased shedding, which is one of the reasons doctors often check ferritin and iron levels when investigating hair loss in women. So now that we understand both sides, let's compare them directly, because the differences really matter when it comes to figuring out the right approach. In terms of cause, male hair loss is driven primarily by DHT sensitivity in genetically predisposed follicles. Female hair loss is driven by a broader combination of genetics, hormonal shifts, and sometimes underlying health conditions like thyroid issues or iron deficiency. In terms of pattern, men typically see a receding hairline and crown thinning that can progress toward baldness. Women typically see diffuse thinning across the top of the scalp with a widening part, and complete baldness is far less common. In terms of age, men can start experiencing pattern hair loss as early as their late teens or 20s, and it tends to progress steadily. Women often notice changes later, frequently around pregnancy, or more commonly around the perimenopause and menopause years, although it can happen earlier too. In terms of hormones, DHT is the central hormone in male pattern baldness. In women, it's more of a hormonal balancing act involving estrogen, progesterone, thyroid hormones, and androgens together, which is why female hair loss often needs a broader medical evaluation rather than a single obvious cause. In terms of treatment, some options overlap, but others do not, and we'll get into exactly which ones in a moment. And in terms of recovery, this depends heavily on the underlying cause. Hair loss linked to a temporary trigger, like pregnancy, stress, or a nutrient deficiency, often improves significantly once the underlying issue is corrected. Hair loss linked to genetic pattern baldness tends to be progressive and usually requires ongoing treatment to manage rather than a one-time fix. Now, here's something really important. Not all hair loss is pattern baldness. Both men and women can experience hair thinning from a shared list of everyday causes, and identifying these matters just as much as understanding genetic hair loss. Chronic stress can push a large number of follicles into the resting phase at once, a condition called telogen effluvium, leading to noticeable shedding roughly 2 to 3 months after a stressful event. A poor diet lacking enough protein, since hair is literally made of a protein called keratin, can weaken new hair growth. Vitamin deficiencies, particularly in iron, vitamin D, and zinc, are strongly linked to hair thinning in both sexes. Rapid or extreme weight loss, especially from crash dieting or certain medical procedures, can shock the hair cycle in the same way major stress does. Smoking has been associated with reduced blood flow to hair follicles and increased oxidative stress on the scalp. Poor sleep disrupts the hormonal and cellular repair processes your body relies on, including those involved in healthy hair growth. Certain medical conditions like autoimmune disorders, and certain medications, including some used for blood pressure, depression, or arthritis, can also list hair thinning as a side effect. If your hair loss came on suddenly rather than gradually, one of these shared causes is often the reason, and it's worth discussing with a doctor. Now for the part everyone's been waiting for, the treatments that are actually backed by real evidence. Let's start with minoxidil, which is available over the counter and is one of the most well-studied treatments for hair loss. It works by prolonging the anagen growth phase and improving blood flow to the follicles, and it's approved for use in both men and women, although the concentration and formulation can differ. Finasteride works differently. It's a prescription medication that blocks the enzyme responsible for converting testosterone into DHT, directly targeting the main driver of male pattern baldness. This is why finasteride is specifically approved for men. It is not recommended for women who are pregnant or who may become pregnant, due to potential risks to a developing baby, so this is very much a case where a treatment for one sex is not automatically safe or appropriate for the other. Nutrition plays a genuinely supportive role. Getting enough protein gives your follicles the raw material to build strong hair. Correcting an iron deficiency, when one is present, can meaningfully improve shedding, particularly in women. Vitamin D also plays a role in the hair follicle cycle, and low levels have been associated with hair thinning. Now, biotin deserves an honest mention here, because it's marketed everywhere as a miracle hair growth supplement. The truth is, biotin only makes a real difference if you're actually deficient in it, which is relatively uncommon. For most people with a normal diet, taking extra biotin is unlikely to significantly boost hair growth on its own. Beyond supplements, basic scalp care matters more than people realize. Keeping the scalp clean and healthy supports the environment your follicles are growing in. Managing stress through activities like exercise, meditation, or simply better time management can help regulate the hormonal triggers behind stress-related shedding. Getting consistent, quality sleep supports your body's overall repair processes, including hair growth. And regular exercise improves circulation, which benefits follicle health as part of your overall well-being. For more advanced or unclear cases, seeing a dermatologist is genuinely one of the smartest moves you can make, because they can identify the exact type and cause of your hair loss through examination and, when needed, blood work, rather than you guessing based on generic advice. And for those with more advanced hair loss who want a permanent option, hair transplant surgery is available for both men and women, and involves relocating healthy, DHT-resistant follicles, often from the back of the scalp, to thinning or balding areas. Now let's clear up some of the most common hair loss myths out there, because misinformation spreads fast, and it can genuinely delay people from getting real treatment. Myth number 1, wearing hats causes hair loss. This is false. Hats do not suffocate your follicles or cut off circulation in any way that causes hair loss, unless the hat is so tight it's literally pulling on the hair, which is a completely different issue called traction alopecia. Myth number 2, shampoo causes hair loss. Also false. The hair you see falling out while shampooing is typically hair that was already in the resting telogen phase and was going to fall out soon anyway. Shampoo is simply speeding up the release of hair that was already on its way out, not damaging healthy growing follicles. Myth number 3, cutting your hair makes it grow back faster or thicker. This one persists forever, but it's not true. Hair growth happens at the follicle level under the skin. Cutting the visible strand has zero effect on how fast or how thick new hair grows from the root. Myth number 4, hair oil can cure baldness. Hair oils can absolutely improve scalp health, add shine, and reduce breakage of existing hair, which is genuinely valuable. But there is no evidence that any oil can reverse genetic pattern baldness or regrow follicles that have already stopped producing hair. And myth number 5, stress is the only cause of hair loss. As we covered earlier, stress is definitely one legitimate cause, but it's far from the only one. Genetics, hormones, nutrient deficiencies, thyroid issues, and underlying medical conditions are all major players too, and blaming everything on stress alone often means the real cause goes untreated. So when should you actually see a doctor about hair loss? A few warning signs are worth paying attention to. If you're losing hair in sudden clumps rather than gradually, if you notice bald patches with a distinct, well-defined shape, if your scalp is itchy, painful, or shows redness and scaling, if the shedding started right after a major illness, surgery, or medication change, or if you simply aren't sure what type of hair loss you're dealing with, it's time to book an appointment with a dermatologist. Catching the cause early gives you far more treatment options than waiting until the thinning becomes severe. So let's bring it all together. Hair loss in men is primarily driven by DHT and genetics, showing up as a receding hairline and crown thinning that can progress toward baldness over time. Hair loss in women is driven by a broader mix of genetics, hormonal shifts like pregnancy and menopause, and underlying conditions like thyroid disorders, PCOS, or iron deficiency, typically showing up as diffuse thinning across the scalp. Both men and women can also experience shared triggers like stress, poor nutrition, and certain medical conditions. And while some treatments like minoxidil work for both, others like finasteride are specifically for men, which is exactly why understanding your own type of hair loss before choosing a treatment matters so much. The most important takeaway here is this: don't wait and don't guess. The earlier you understand what's actually causing your hair loss, the more options you have to slow it down, manage it, or in some cases, even reverse it. Hair follicles that have completely stopped producing hair are much harder to bring back than follicles that are simply struggling, so acting early genuinely makes a difference. If you found this helpful, don't forget to like the video, subscribe, and turn on notifications for more science-backed health content.